Hi guys, Dr. Anjana Bana here and welcome back to my YouTube channel. So today we're going to talk about how to change the shape of your nose using botulinum toxin. So it's a chemical change of the nose, so no surgery involved, and using mechanical forces to manipulate the way the nose looks. Okay, so today we're going to demonstrate the movements of the nose and where we would inject botulinum toxin and how it would actually change the shape of the nose. So in South Africa, we've got 3 toxins available, and you've watched numerous videos, our toxin videos before. We'll put some links in the caption of some of our toxin videos, but all these toxins aren't exactly interchangeable, so they're all diluted a different way, although the mechanism of action, the way they work, what they target is the same, and it is all botulinum toxin A. Generally we use this quite a bit, and you know, people say for precision they love this one, and this is the OG of the toxin world, so just that you know what's available in the country, but they all FDA approved, they all work well, and they've all been in use for many years. So I'm just gonna pop on some gloves before I poke around your nose, Bev. So most patients are concerned when they come in for changing the shape of their nose, the bridge of their nose. So that, you know, toxin, that's one thing you can't really alter significantly with toxin. So there's fillers are placed in the nose. I'm not a fan of nose filler because of the high risk of vascular compromise, and also the high risk of, besides the vascular compromise, blindness from filler. It's a very rare complication, as is the vascular compromise, but the nose is one of the danger areas as well as this area. There are still some people who inject filler into the glabella where the frown is. I don't think it's a good idea, but I suppose if you sit down and discuss with your practitioner, your doctor, the risks and benefits, and decide from there. But if you scrunch your nose, babe, can you scrunch? So there's this, you know, people call it the bunny line. So there's a muscle that's part of your frown called procerus. So that is part of the scrunch, as well as these muscles are here. The nasalis muscles. So when that's injected, so often when we do crow's feet or we do the upper face toxin, then this isn't done, and that's the only thing moving and pumping some lymph. But people don't like it, especially if they've got a prominent bunny line, scrunch, and it's not just the nasalis. There's some involvement here and the corrugator, but generally people inject the nasalis, and the risk there is, in terms of the way it looks, it can broaden the look of the nose. But if the bunny lines bother you, it is something you can think of. But if you do any toxin there, it's not going to completely obliterate them, which is fine, so you don't look weird or strange. And then coming down to the tip of the nose, so I kept on asking Bev, smile, relax, smile, relax. So what I wanted to see is that when Bev smiles, like so, Bev, if you can smile for me and then relax and smile. So it's not that pronounced on Bev, but sometimes what happens is when people smile, the tip of their nose dips. So there's a muscle here, a depressor muscle, a depressor septi muscle, that is pulling the nose down. As she smiles, as you age, it becomes more prominent, and it is a little bit of an uncomfortable injection, but straight down on bone. Some botulinum toxin is placed there, and it actually relaxes the muscle, lifts the tip of your nose, so you get a bit of a nose tip lift, and when you smile, then the nose tip won't go down. So a lot of people with a bit of a hook on their nose, they like doing a treatment like that. The other treatment you can do in terms of changing the shape of the nose are the ala, or the wings of the nose, so narrowing the nostrils. So there's a dilator muscle here and a little bit on the side. They call it ala nasalis, so like that. That helps the nose expand, and then in the middle there's like a compressor muscle. So you don't want to knock that out, because Botox relaxes or paralyzes the muscle. So if you knock out this compressor, you basically like dilate more. So you have to get into the dilator. So it's just a little injection here on the wing, and 10 days later you have a more aquiline, like more streamlined nose. So that is how you can do a simple change, a simple shape change of the nose with very little risk. The same with other toxin treatments. You know, it usually lasts around 3 months. You'll probably start getting a little bit of movement before then, but it's an excellent way to do a bit of a test drive on any nose changes. If you have any questions about the video today, please drop them in the comments down below. Like, share, and subscribe. Bye.